Hi again. I wanted to share with you something that's not uncommon in many of us, and your symptoms indicate this is likely one of your problems. Are you familiar with the vagus nerve? Or how about the neurotransmitter called acetylcholine? I'll share with you my story and how I figured this out, okay? Bear with me, but I think it will be helpful for you to understand this and how it got missed in many of us. You see, I had horrible gastroparesis that sent me to the emergency room when I hadn't had a bowel movement for 11 days. They tried everything, as did I, to encourage a bowel movement. Nothing was working. But at the time, I suspected my vagus nerve was somehow involved. When this happened, I also had some pain in my lower right hand abdominal area. We ruled out most everything causing that pain, and the doctors discovered that my gallbladder ejection fraction was low, and I was told to have my gallbladder removed. I chose not to, though, and here was my thinking. I asked if the gallbladder was filled with stones. No stones. Was the opening of the duct blocked or somehow not working? No, that looked fine. Was the organ enlarged, inflamed, or fibrotic? No, it looked okay. Well, then this was sounding neurological to me, and I didn't want to remove a healthy organ if I could figure this out, so I declined gallbladder surgery and instead found myself at the urologist's office to rule out kidney stones. He performed a scan where I ingested barium, but no stones were found. He was at a loss for the cause of the gastroparesis and the pain. I shared with him my suspicion that my ileocecal valve, the valve between the small and large intestine, was perhaps stuck in the closed position. He agreed that it was possible and sent me to a thoracic surgeon who told me that not only did he not want to perform surgery, he told me that if I suspected my vagus nerve was involved, never to have abdominal surgery unless it was life-threatening, because surgery can cause gastroparesis because they cut right through the vagus nerve during surgery. Yikes. 3 days later, I did have a kidney stone. I know, weird, right? At the hospital when I woke up, my urologist was right there and said, "Diana, you're right." I said, "What?" He told me that it was my ileocecal valve. It turns out that they use imaging during stone removal, and the barium he gave me 3 days before was all crammed up against that valve. Wow, I thought, we got it. So what do we do? And he said, "I don't know." So I went home, still with no help, no answers, no medication, and no bowel movement. Now, what do we as patients, what are we supposed to do when it seems like we've exhausted all avenues for help, right? That was the position I was in. I was miserable. So I did the only thing I knew I could do. I had to assume I was right. I remember thinking, I'm on my own here, so let's just assume I'm right. My vagus nerve is affected. So what could I do? Well, I remembered from optometry school and our lecture on autonomic nerves that the vagus nerve has two components. It has the long preganglionic portion of the nerve that goes from the brain down the neck to all the organs, be it the heart, lungs, GI tract, or whatever. Then there's a little gap or synapse, and then there's a tiny postganglionic portion of the nerve, which is very, very, very small. It's almost part of the organ itself. It's so small. I wondered if my preganglionic nerve was defunct for any reason. I was considering compression at the time, but could I possibly stimulate the postganglionic portion of that nerve and have a bowel movement? The preganglionic vagus nerve stimulates the postganglionic portion by sending a neurotransmitter, that is acetylcholine, across that gap, which then stimulates the organ to respond. We can't use acetylcholine as a drug inside the body because the body immediately breaks it down. We have to use an imitator, what we call an agonist. Now, the vagus nerve is special. It's a nicotinic acetylcholinergic nerve, and a good agonist for this nerve is nicotine. So I called my husband at work and asked him to bring home a nicotine patch. And I placed the patch on my lower right-hand area of my abdomen near the ileocecal valve. I didn't know if that would matter. But about an hour later, things started moving, the valve opened, and amazingly, I had a normal bowel movement. Shocking, right? I couldn't continue to use a nicotine patch because nicotine activates histamine producing cells, and I became incredibly inflamed. It looked and felt like I was being attacked by a swarm of fire ants on my abdomen. It was horrible. But my response taught me two things. First, my receptors were working fine. I did not have some rare autoimmune problem causing my gastroparesis. I didn't have a receptor problem. I had a neurotransmitter problem or a problem with the preganglionic portion of my vagus nerve. We could then stop focusing on autoimmune conditions, and instead we turned to studying acetylcholine. Another huge breakthrough came when I studied the symptoms checklist that hundreds of patients with EDS PODS, chronic fatigue syndrome, chronic Lyme disease, and fibromyalgia sent to me. Many of us had some strange visual symptoms. For example, some were bothered by viewing textured surfaces. Others had hallucinations. Some of us saw insects or spiders in our vision. At first, I had no idea what patients were talking about with these symptoms until they started mentioning having snowy vision. That's when it hit me. And by studying these checklists further, I saw that most patients with these chronic invisible illnesses were suffering with the majority of symptoms of acute anticholinergic syndrome. That is, many of us were so deficient in acetylcholine, it was as if we had been poisoned by an anticholinergic drug. The symptoms would ebb and flow, however, unlike being actually poisoned. We didn't progress to coma, seizures, and death, for example, and we had such a huge number of symptoms overall that our physicians weren't recognizing this. Likely, the reason I was able to piece this together was, one, I was a patient experiencing some of these weird symptoms, and two, I'm an eye doctor, and eye doctors are very aware of these symptoms because we prescribe anticholinergics every day. Those drops that your eye doctor puts in your eyes to dilate your pupils, those are anticholinergics. We learn the pharmacology, we know the presentation. So it came together for me. I think very low acetylcholine levels is a huge stumbling block for the majority of patients suffering with extreme and chronic fatigue, and for many folks with idiopathic gastroparesis. And the good thing is, we can treat this fairly easily. Effective treatment was a necessary step for my own recovery and for the recovery of my children, and I think it will be critical for you.